Imagine this. A quiet evening, say, in Johannesburg. It's a city pulsing with energy, usually.
Mm-hmm.
But suddenly there's this chill in the air. News hits. Life-saving HIV clinics.
Yeah.
They're shutting down, like within hours.
Wow. Not hypothetical, you're saying?
No, not at all.
Uh,
This was the stark reality, January 20th, 2025. Just devastating for so many South Africans. What happens when a lifeline just vanishes?
it's an immediate shockwaves, isn't it? A profound one. And, we're talking about South Africa, a nation already carrying the heaviest HIV burden globally.
Facing another huge challenge.
Exactly. And what's really striking here is just how fast this all happened, the speed and the scale.
Absolutely. So today we're doing a deep dive into this crisis.
Mhm.
It's had such a profound impact. We're focusing on those ripple effects from the recent U.S. foreign aid cuts, specifically to PEPFAR, the President's Emergency Plan for AIDS Relief.
Right, and the systemic problems this whole situation has really exposed, or maybe made worse.
Yeah, exposed and definitely exacerbated across the health system there.
So our mission today really is to try and unravel the human toll behind the headlines you might have seen.
We want to help you connect those dots,
Yeah.
between the big policy shifts and the deeply personal daily struggles people are facing.
And crucially, we also want to look at the resilience. Because it's there. Communities are fighting incredibly hard to survive this.
And the initial numbers are just staggering to look at. That U.S. funding historically was around $440 million a year.
Which sounds like a lot, and it is. It covered about 22% of South Africa's own HIV budget, which itself is huge, like $2.56 billion.
Then, almost overnight, that funding gets slashed by about $427 million. Gone.
And that wasn't just, an abstract number on a spreadsheet.
No way. It meant instantly 12 nonprofit clinics had to close their doors. Just imagine. 12 vital centers.
The impact was immediate. It was devastating. Those closures meant over 63,000 patients lost their immediate care.
63,000.
Yeah.
Okay.
And potentially another 220,000 people facing interruptions in getting their daily life-saving meds.
The scale is just immense. It really threatens to undo decades of progress, hard-won progress against HIV there.
It really shows how fragile things can be, doesn't it? Even long-standing health programs, when that external support just disappears.
Let's try and really grasp the full scope here. South Africa is home to roughly 7.8 million people living with HIV.
7.8 million. It's a huge number to even comprehend.
And within that huge number, there are 270,000 children under 14.
250,000 kids.
Wow. Their lives just profoundly shaped by this.
And looking at how it spreads, it's particularly heartbreaking for children. Every year, about 10,000 kids get HIV. Often, it's mother-to-child transmission.
During pregnancy or birth or breastfeeding.
Exactly. And tragically, around 2,100 children die from HIV-related illnesses each year. So for decades, PEPFAR was absolutely fundamental in fighting this. It wasn't just about pills.
That's such a crucial point. PEPFAR wasn't only distributing ARVs, the antiretroviral treatments.
No.
It was building a whole support system. It funded testing, education campaigns, vital research.
And maybe most importantly, those community programs, the ones dealing with the social side, the emotional challenges of living with HIV.
So we're talking about a holistic safety net, really, not just medication.
So that withdrawal, that $427 million, it's not just a budget cut. It's pulling the rug out from under millions. It's a lifeline being severed.
And the warnings are stark now.
Experts are genuinely warning about potentially hundreds of thousands of new infections, tens of thousands of deaths in the next few years if other funding isn't found urgently.
What's at stake is just immense. It really exposes how some of this global health progress was maybe built on foundations vulnerable to, a single policy change somewhere else.
Which brings us to the heart of it, really, the human cost.
Yes, these aren't abstract numbers. They're people, families, communities. Let's get into some of those stories from the ground. Maybe start with Mary in Soweto.
Okay, so Soweto.
Yeah.
Bustling township, just south of Joburg. We heard about Mary. She's 36, a single mom, HIV positive since 2008.
And her daughter.
Her daughter, Lita, who's 12 now, she was born with the virus. For years, Mary relied on this community group, Crystal Fountain. They were PEPFAR funded.
And Crystal Fountain, like you said, it wasn't just about the ARVs, right?
Exactly. They delivered the ARVs to her door, which was crucial when maybe she wasn't well enough to go to a clinic. But they also gave food vouchers.
For essentials, like maize meal, vegetables.
Things vital for managing HIV. Because, good nutrition directly boosts the immune system, helps the ARVs work better.
Without that, the pills themselves aren't as effective. It's all linked.
Totally. And last year, Mary had that incredibly tough moment telling Lita about her HIV status.
Oh, I can't imagine.
Crystal Fountain's support program helped her through it. She said, they made us feel supported like we weren't alone, but now,
Now the funding's cut.
yeah, the food aid, gone. The support groups, gone. Mary's just left saying, I don't know what we'll do. It's this awful uncertainty just hanging over them.
And Mary's story, sadly, it's just one thread in this much larger, grim picture.
Absolutely. Think about this other case. A 37-year-old sex worker in Johannesburg. Understandably, she wanted to remain anonymous.
Okay.
She went 4 months, 4 agonizing months, without her medication after her nonprofit clinic closed.
4 months.
Yeah.
That's incredibly dangerous.
Terribly dangerous. And then, to make things worse, she gets turned away from public hospitals.
Right.
They said she didn't have a referral letter.
Even though official guidelines say that's not supposed to happen.
Exactly. Her fear for her 3 kids was just, you could feel it, worrying how she'd explain being sick.
What happened then? Any help?
Well, in June 2025, a mobile clinic came through. A brief reprieve. Gave her a month's supply of ARVs.
Just a month.
Just a month. The path forward is still incredibly unclear. The anxiety is still there. And we heard about another sex worker who felt forced onto the black market.
Oh, no.
Buying ARVs there for about $25 a bottle, nearly double the old price. And zero guarantee about quality or even if they're real.
That's a desperate, risky choice to have to make.
And then the challenges just get amplified for other vulnerable groups. We heard from a transgender woman.
Yeah.
She described being mocked, shunned by staff at a public clinic. The humiliation was so intense.
That's awful.
She decided she had to buy her medication privately, even moved back in with her mother just so she could afford it. Her words were just so powerful. I'm not going back to a place where they treat me like a clown.
It just captures the indignity, doesn't it? The lack of basic respect in trying to get health care.
It really does. And these stories, they starkly show how losing these U.S.-funded clinics hits the most marginalized hardest. Sex workers, trans individuals, low-income families.
People already facing barriers.
Exactly. Already dealing with prejudice. These cuts are pushing them further out, making consistent care almost impossible.
So it's really laying bare these deep systemic problems, isn't it? And the discrimination baked into the system.
For sure. Closing the nonprofits pushed everyone toward public hospitals, but that transition, it's been anything but smooth.
Far from it.
We're hearing, like with that sex worker, patients being turned away without referral letters, even though the official policy says that shouldn't be a barrier.
So there's a disconnect between policy and practice.
A huge one. Kate Rees, a public health specialist at Inova Health Institute in Joburg, she put it bluntly. It's not supposed to happen, but nurses, security guards, or doctors sometimes refuse treatment.
Even though the health department spokesperson, Foster Mohall, insists no one should be denied care.
Right. The reality on the ground seems very different for some people.
And it's not just about getting through the door, is it? It's the discrimination once you're inside.
Exactly. Especially for sex workers, for trans people. We heard about a transgender woman being told wrongly at a hospital that pre-EP, the pre-exposure prophylaxis, the prevention medicine.
Yeah, for high-risk individuals.
She was told it was only for people in specific relationships trying to have a baby.
Yeah.
Which is just completely wrong. Dangerous misinformation.
Wow. That kind of bias, those misconceptions, they actively push people away, don't they?
They absolutely do. Pushes them towards risky options like the black market, or worse, just giving up on treatment entirely.
And without regular testing, people don't know their viral load.
Right, the amount of virus in their system.
Yeah.
Which increases the risk they could transmit HIV to others. It becomes a much bigger public health threat.
Now, South Africa's health minister, Aaron Motsoaledi, he said the government gets 90% of the ARVs itself and will keep supplies flowing.
Which sounds okay on the surface, but
like we've been saying, the cuts hit so much more than just the drug supply.
Exactly. Rebecca Chicane, the social worker from Crystal Fountain, she nailed it. It's not just about the pills.
It's the food vouchers.
The support groups, helping families cope with the stigma, the emotional weight of HIV, that whole holistic system.
It's gone, leaving this massive hole.
So what does this mean, bigger picture, the broader impact, the global context?
Well, a concern from experts is grave. Without urgent action, South Africa could see a terrible resurgence. New infections, more death.
Basically reversing decades of progress.
Yes. And this isn't just contained to South Africa, is it?
No, it has global implications. The UN estimates globally up to 4 million people could die from HIV by 2029 if these kinds of aid cuts aren't offset somehow.
4 million. That's terrifying. And in South Africa, even before these cuts, about 2 million out of the 7.8 million HIV-positive people weren't getting treatment.
So this crisis is bound to make that number even larger, an already bad situation getting worse. It really highlights how linked global health funding is.
What about the politics behind this, the U.S. stance?
Well, the Trump administration defended the cuts. They talked about misalignment with U.S. interests, the huge U.S. national debt, $37 trillion.
Okay.
Russell Vought, who was the director of the U.S. Office of Management and Budget back in June 2025, he said it quite bluntly. Africa needs to absorb more of the burden
Of providing this health care.
Yeah.
Wow, so a domestic budget argument used to justify pulling back on global health aid.
Pretty much. It signals a real shift, doesn't it? Away from seeing foreign aid as maybe a humanitarian investment towards more of a focus on national self-interest first.
And the reaction in South Africa.
Understandably, immense anger. A feeling of betrayal. Some people pointed fingers, mentioning maybe the influence of South African-born billionaire Elon Musk in the early talk about cuts.
Right.
But the core feeling, like that transgender woman expressed so simply but powerfully, is our lives matter. A deep sense of injustice.
And zooming out even further, you said this isn't happening in isolation.
No, it's part of a wider trend. The UN itself has had to scale back humanitarian aid plans. They called it the deepest funding cuts ever.
How bad is the shortfall?
They only received $5.6 billion out of the $44 billion they asked for in 2025. Just a fraction.
That's barely anything.
Tom Fletcher, who heads the UN's Humanitarian Coordination Office, he described it as a chilling triage of human survival.
Triage of human survival. That's a heavy phrase.
It is. South Africa's HIV epidemic is now effectively competing for scarce resources with crises in Sudan, Gaza, the DRC, Myanmar, all these other urgent situations.
It just shows the impossible choices being made, doesn't it? Where helping one area might mean another area suffers because the overall pot is too small.
Exactly. It's the devastating reality of finite resources versus overwhelming need.
But despite this incredibly grim picture, you mentioned resilience earlier.
Yes. And it's truly inspiring to see it. That individual determination really shines through. Back in Soweto, Chapiso.
The mother whose baby son was diagnosed.
That's her. Her 9-month-old, Kalani, diagnosed at birth. She found real comfort and connection in that Crystal Fountain support group before it stopped.
She must have felt so alone initially.
She said it was incredibly hard to accept his diagnosis. But sharing stories, talking with other parents in the group, it helped her feel less alone, more empowered.
And now the group's gone.
Yes. She faces huge uncertainty, but she is absolutely determined to keep Thulani healthy. And people like Rebecca Jacan, the social worker, they're still out there advocating, fighting for families, stressing nutrition, emotional support, even without formal funding.
That takes incredible dedication.
It really does. And elsewhere, like in Mpumalanga province, Thulisil Mahol, she used to work for GIP, the Greater Rape Intervention Program.
Providing essential support.
Critical support for rape survivors, HIV prevention. Her organization closed. She said it's heartbreaking to tell people there's nowhere for them to go.
But she's not giving up.
No. She and others are actively looking for ways to rebuild, trying to find local funding, create new partnerships to bring back these vital services.
And activists, too, right?
Absolutely. People like Yvette Raphael, co-founder of Advocacy for Prevention of HIV and AIDS. Her message is powerful. We've fought too hard to go backward. That determination is a real counterpoint to the despair.
So there's this grassroots energy pushing back. What about the government response?
Well, the South African government has vowed to fill the funding gap. That commitment is essential, obviously. But the scale of the task, it's just daunting.
Can other international donors step in?
The Global Fund, maybe others, they might provide some relief, but realistically, their contributions are unlikely to match the sheer size of the U.S. aid that was lost.
So it falls back on the communities.
In many ways, yes. Grassroots organizations are rallying. Their determination is like a beacon, really, in the face of all this adversity. It shows that even when external support dries up, that will to survive, to thrive, it persists within the communities themselves.
We've covered a lot today. It's complex and honestly quite heartbreaking at times, from those big policy decisions made miles away in Washington.
All the way down to the intensely personal struggles of Mary and Lita and that anonymous sex worker and Chapiso, countless others in Joburg, Soweto, across the country.
Their stories are just such a powerful reminder, aren't they? Behind every statistic, every percentage point, there are real people.
Fighting not just to survive, but fighting for dignity, for consistent care, for hope for their future.
The world really is watching South Africa now.
Yeah.
how this plays out. It's a test.
It's a test of the nation's resilience, which is clearly immense, but it's also a test of the global community's commitment to solidarity, especially when there are so many competing needs.
It really forces us to think about how connected we all are, our
Well,
shared responsibility. So
absolutely.
as we wrap up, thinking about this huge impact, not just the lack of pills, but the loss of food aid, the psychosocial support, that whole web of care,
Mm-hmm.
leaves us with a pretty tough question, doesn't it?
Mm.
In a world that's facing so many crises, all demanding attention, all needing resources, and where, let's face it, political priorities can shift so quickly,
Yeah.
what is our collective responsibility, our moral imperative maybe, to make sure the progress we've made, like decades of fighting HIV, isn't just wiped out because attention moves elsewhere? And what does it truly mean at the end of the day to value every single human life?